Hey, this is Aubrey and Jordan with Education, and today we're making a video to help teach how to do proper insertion of Foley for our residents who are going to be training for Skills Day this next Friday. So there's a couple of things that we've run into specifically that we wanted to make sure and point out, and I will address those as we're going through the process. One thing is that our kit with the dual level is currently on back order, and this is the kit that has been sent in its place until we get some more in. So the kit that they're going to be using is the barred single level tray, and it does have the iodine swabs in it. So the first thing you're going to do, obviously, is your hand hygiene. You would be introducing yourself to your patient, explaining to them what's about to happen, educating them on any risks as far as falls, infection risk, keeping the Foley bag down below the level of the bladder, and then why we need to try and get the Foley out as soon as possible to help keep them safe. We do have a policy here that we do a 2-person insertion on Foleys, and so that's how we're going to be checking them off as well. They'll be sent to you in pairs, and so one person will be inserting while the other person maintains that we are keeping our sterile field and not contaminating our catheter. So once we've talked to our patient about what's going to happen, we're going to go ahead and get them in position, and so we're going to make sure that our legs are spread out. The bed I've already lifted up as far as I can to the right level for myself. And then depending on how their comfort level is, you can have them bend their legs and put their feet flat, or just spread their legs out wide. One of the things that we have noticed when we've done our validations is that the students are being taught to throw away a lot of the kit, even by their instructors at school. And so what we want to make sure we validate with them is that everything that's been put into the kit was collaborated on by multiple teams, including the infection prevention team. We don't want to discard pieces of it because it all has a purpose. So when we first open it up, it's going to give us our information about what we're using. This is a 16-French Foley system. It's going to have our expiration information to make sure that we are not expired before we use our kits. And then there's going to be a package on top, and this tells us what our very first step is. And so we're going to be doing our peri area clean. We do want to make sure that we instruct them that this is not the sterile clean where you just do a single wipe on each side down the middle. These are towelettes that you're going to use to remove any kind of secretions or buildup or anything that's going on with your patient, especially if they're incontinent, to make sure that you limit infection as well as we can. When you open it up, there's a couple of things in here. There are your Castile soap towelettes. There's 3 in here. And then there's also your Purell hand sanitizer. So we're going to go ahead and open this up and do a clean. And again, this is not part of the sterile process. And you can have a trash area down here or bring the trash can over, whatever your personal preference is going to be. And then we want to make sure that we're educating them on the correct way to use the Purell as well, because we did have several people try and pop it open facing their face and nearly got it into their eye. So okay. Discard our gloves. Trash over here. And then we hold this with the Purell side up, so blue to the sky. When we pop it, it's going to squeeze it into our hand. Go ahead and clean our hands. And then you're going to see several pieces of paper on top of your kit. The first one is a patient and family education insert. It talks about what we're doing, and it has it both in English and in Spanish. So this is really helpful to give to your patient, especially if they're Spanish speaking, to talk them through the process. There's also in here directions for use. So if you haven't put in a catheter in a really long time and you just don't feel very confident about it, it walks you through the whole process, what each step is for, and answers all those questions. Our orange insert is going to be our label. We want to make sure and label our bag, and so you'll just fill it out, peel it off, and stick it on your bag. You'll do this after you complete the sterile part of your process. If somehow this gets thrown in the trash, you can just use a Sharpie marker or an IV label, tubing label, fill out the information and stick it on there. The main thing is we need to have the time and date of insertion and the initials of the person inserting. When you get down to the actual kit, there's several pieces of information on here. There's an arrow that tells you which way you should orient towards your patient. So we're going to have this facing this way towards our patient insertion site. It's going to tell us how to utilize our proper technique. You're going to open your wrap, put on your sterile gloves, place your under pad, then drop your fenestrated drape and follow the tray instructions. Another thing we found when we were doing our validations is that a lot of people were standing over here and opening up their tray, and then they were sort of turning and having their back to their sterile field, which we know then makes it not a sterile field. And so they need to actually put it on the bed here with the patient and prepare everything in this area. So we always open away from ourselves first, knowing that the outside inch is considered not sterile. And then I'm going to get my sterile gloves out and put those on. Remember, once you get your sterile gloves on, you can adjust them once both hands have been gloved if you're having issues. With the second glove, we want to make sure that we aren't holding it with our thumb right there. That's something that we saw a lot of people do when they're gloving. It needs to be just that scoop under the hand with the fingers. Once I'm gloved, then I can adjust, making sure that everything is in the right location. So I'm now sterile, and everything that I touch has to be within my sterile field so that I don't contaminate my hands. There's a couple of drapes that you're going to see in your package. First, we have our two-sided drape here that has a plastic shiny coating. I don't know how well you can see that. That shiny side needs to go down. It's actually a barrier for fluids so that it helps to keep the patient's bed dry. I wouldn't worry too much about trying to get that just tucked in super tight. And the more that you adjust things and move things, the more likely you're going to be to contaminate yourself. So just sort of drop it right there, right where the patient is, and then just leave it. One of the biggest things that we saw too is that this fenestrated drape was discarded by almost all of the people who came through because they were taught in school that it wasn't necessary. And so we want to make sure we educate them that this is definitely a part of the kit that we want to use. It helps to create more of a sterile barrier, and so we're going to go ahead and use that with both our male and female patients. Just sort of tuck it in right there. And then we want to make sure that we completely prep our kit before we reach up to do our sterile clean and contaminate our hand. And so with this particular kit, I'm going to mimic applying my iodine since it can't be used on the mannequin, but I would go ahead and tear open my iodine and apply it to my swabs. Twist the swabs to get them loose so that they're easily accessed. Over here you have your tube of lubricant and your syringe. So I'm going to go ahead and open up this tube of lubricant and put it in the trough. I'm going to take the blue sheath off of my Foley catheter. Keep it from sort of flailing around. I'm going to go ahead and stick it in there. And then I've got my tube of saline to attach to my port. It is no longer best practice to inflate your balloon prior to insertion, so we're just going to attach that and leave it right there. So once I have all that stuff ready, I'm ready to put in my Foley. So just want to make sure that you're in the right position. Again, you're going to have a second person with you just watching to make sure that you don't contaminate your field. So because I'm right-handed, I'm going to take my non-dominant left hand and place it over here to clean with. First swab, we're going to clean to the side, drop. Second swab, we're going to clean to the side, drop. And the third swab, we're going to clean straight down the middle and drop. Now I'm ready to go ahead and put my Foley in. So I've got my lead one here. We want to make sure that when we put the Foley in, we don't get our sterile hand too close to the meatus. So we're going to advance from about an inch or so away. And then once we get urine return, we're going to advance just a little bit further. And this is where we found the number one thing that we had issues with. A lot of people want to and are taught to use their non-dominant hand to secure the catheter and use that to inflate the balloon. So I would be letting go with this hand, I would be securing with this hand and inflating the balloon. However, if you let go with this hand and you secure with this hand's dirty. So if I reach down and pinch this, then I'm going to contaminate it with everything I had on this hand when I clean my patient. What we actually need to do is continue holding with our sterile hand, reach over with our dirty non-dominant hand and inflate our balloon, because that syringe is not having to stay sterile. Once that is done, we can give a little tug to make sure the placement's correct, release our syringe, and we're done. That completes the sterile part of the process, so we no longer have to stay sterile. You can go ahead and unglove from your sterile gloves if they're soiled, put on a pair of clean gloves, and then continue your process. One thing that we also found was that a lot of people have not put on a stat lock and are not really sure how to apply it. And so we want to make sure that we're educating the patient about what's in this package and how it works. We have our skin prep in here, which is not actually used to clean the skin, which is what a lot of people were under the impression of. It actually applies a thin layer of plastic to the skin, so that once you put it on the skin and then you put the stat lock on top of it, when the stat lock is removed, it removes the plastic instead of the patient's skin. It's a protectant. When you put your stat lock on, you want to put it on before you attach it to the patient. That way you're not pushing down on them and creating some kind of pressure injury. If you're not sure how it's applied, if you turn it sideways and clip it, you will see that there are two holes, a bigger hole and a smaller hole, and that will help guide you which one needs to go in there, because we're going to put in the smaller tube and the larger tube to anchor it down. Once you put it on, you're going to hear the click, and then you would apply it right where your stat lock prep goes. Then you'll take your bag, and you can go ahead and put it down at the bottom of the bed. Make sure that you put your label on there, that all your information is contained, and then go ahead and clean up your work site. If you have a patient who is needing to have a culture sensitivity drawn at the same time that you are doing your insertion, I would suggest going ahead and putting your clamp on your line while you're prepping your sterile area before you put this in. That way, as soon as you get urine return and make sure you go through the process, you've got nice clean urine there that you can draw right out of the tube through this port. Remember, we still do scrub this port with alcohol, just like any other port we're going to access. Remember to unclamp it afterwards. Also, we want to teach our residents that if the patient is somebody who's going to be proning, they can't just turn over and lay on this catheter, because it puts them at risk for a pressure injury. So if they're going to prone, we need to take this off, put a stat lock on the back of their leg while they're prone, and then when they supine, then we're going to need to move the stat lock back to the front of their leg. Hopefully this addresses any questions that you have. Reach out to education if you have any other questions. Thank you so much.